Hi, my name's Sari Hewlett. I'm talking to you today about our new program, which is an online, basically transformative back care program. It runs over 8 weeks, and during those 8 weeks, we're going to go through absolutely everything you need to know to make your back better. People find that they've tried this, they've tried that, they've tried a little bit of everything to really manage their back pain. But back pain management isn't just a one step. It's about looking at everything else. It's about looking at what you do day to day. It's about how you hold your body, how you move your body, what influences your back pain, what makes your back pain better. And we're going to go through each segmental little thing. I've basically had 25 years experience managing people with pain, and it really all boils down to one crucial thing, and that's knowing why you get it, what happens, and how to fix it. And most people know that they've got poor posture, or they know that they've got weak muscles, or they come in saying, I want to make my core stronger. But the bottom line is they don't know where to start, and where they start, instead of point A and getting to point Z, they're trying to get in at point K and point M and miss like a really few crucial steps right at the beginning phase. And that's where we're different, and that's where our approach is different. Basically, I think what's happened in the last, say, 20 years since I started as a newbie is that people's lives have got really busy these days. We don't have the time to commit. Also, we've got very lazy, and that's not been detrimental to what we do. But 20 years ago, things were a lot more labor intensive. We had to push hoovers around, we had to scrub floors, we had to physically wash cups and saucers and pans and all sorts. And even when you think about cars nowadays have power steering. So the amount of actual effort and time and things that we do with our body has changed horrendously in the last 10 years, say. We just don't put our bodies through the workload or the use or the time space that they used to have to go through. And that's one thing that people forget, that to get in and out of a car, it's easy these days. A lot of people are in the hire cars. It's not that you have to get very low. It's everything's automated. We go from washing machines to dishwashers to shoving things in laundry dryers. Everything's Hoover wise is using a rumba, so we just press a button and it goes. Our olden style of having to really work and use our bodies and make use of our muscles and joints is gone. And that's one big thing that we forget, that we're not using our bodies. So when people complain that they're in pain, well, you're not doing anything. You're not doing a lot compared to what we had to do 10 years ago. And if you take that on board, that our normal day-to-day activities, our normal day-to-day life is less active, and then on top of that you load the fact that you're in pain and the fact that you don't want to move because it hurts, you just don't know where to start. And that's what we're addressing. We're addressing the fact that you don't know where to start, so let's start right at the beginning. And that's what we're going to do with this course. This course is going to go from point 0 to point 10. It's going to start right at the beginning, which is where people miss. What I tend to find is that people go, I need to build my core strength up, so they want to go and they do boot camp, or they say, I'm really weak, I need to build everything up, so they go and try and do planks. And you're missing a few crucial steps with that too. You're missing the fact that you haven't got any basic core strength to start with. You don't even know where your core is. You don't even know how to activate your core. And then you want to go and brace and do boot camp and do planks. And that's when people get worse, because they haven't got the ability to do that. So we're going to layer in how to activate your core, where your core is, what it means, is yours working, and then how to get going from there. The other thing that we'll go through is posture. What is good posture? Everybody seems to know they've got poor posture, but most of the clients that I see don't have a clue what posture they're in or how to fix that posture. So we'll go through that too. We will do that via telehealth, so that means that you will have my eyes on your body. You will have a front view, a back view, a side view. I will see you walking, I will see you moving, and I'll be able to tell you exactly what muscles you're using, what muscles you're not using, what your posture type is, what that means for you, what you need to avoid, what you need to work hard on, what you need to focus on. And that is really important. If we're doing this by distance, we need to be able to see and watch how you move, because there's no better way to see. If you are static and you're just holding a movement, that's completely different to then trying to be functional and do a movement. So, standing on one leg and staying still is very different to how you would then go up and down stairs, because that's a more functional pattern. So the sort of assessment process and the posture processes all be done by telehealth, which basically means I will still be able to see you. You will have email support, so I will be doing all our sort of coaching via emails. We'll have that also through video content. So I've ran a few sort of mini trial courses as well, which have just been a week long, some back tips, that type of thing, and that's worked really well. And we've had people who have gone off and started to do exercise because they felt confident enough to do so. This course is going to be really in depth though. This is over 8 weeks and it's aimed at giving you a whole heap of support. We'll have a private forum group where you can post and ask questions, and also you've got access to me via Messenger. Hence, over the 8 weeks, it's basically going to be in depth and aimed at what you need as well, and also prioritise and strategic for what you need. The only thing we can't do with you is hands-on. So if I feel that you would benefit hands-on, if I feel that you would benefit somebody actually looking at you and checking if a joint is stiff because I think it might be, or if I think you might benefit from some massage, then I'll definitely tell you and let you know so that you don't miss out on that side of things. If and I would like to have that specific for what I want checking. So there's something that I think would need checking, I'll specifically say, make sure that they look at this and this for me, please. So obviously if you're not in Perth, where I'm from, then I can't do that for you. But that would be the caveat on that section. So by the end of 8 weeks, what will you know? You will know what your posture type is, what that means for you, what that means for your back. If you've had x-rays, MRIs, investigations, I'll get you through to send all those through. So I will be able to link back where your problems are compared to how you move and how you function, and is that consistent with your findings? And a lot of the time it's not. A lot of the time where people find they have disc prolapses or facet joint irritation or arthritic problems, it's not consistent with where their pain and their issues are, because that's an injury or a problem that might have been there for a long time, and what they're struggling with now is more a postural problem, or a problem with how they're moving, or a problem with how they're loading, or a problem with how they're stressing their joints, as opposed to what their x-ray says and what their MRI says. Which is why if you've had ongoing pain and it's getting worse, and you say, look, I really want a new MRI to check where things are, and they do that MRI and the MRI hasn't changed, well, the reason it hasn't changed is because that's not where your problem's coming from. So your MRI isn't going to change, and your disc hasn't got worse, or your arthritis hasn't got worse. What's changed is how you move your body, and how you're moving your body and what your posture's doing is basically what's causing you pain. So that's the aim and the purpose of the course, really. By the end of the 8 weeks, you will have an idea what your posture is. You will have an idea, or you will know what you need to do to improve it. You'll know what to avoid. You'll know what you should do more of. You'll know what kind of strategies you need to implement to be able to stay better. You will know what type of pain comes from what type of area, and where you are stressing your joints and where you are stressing your body. You will know and have some strategies in place with how to cope with that. Now, we can't change damage that's there. So if you've had a disc area that's damaged, if you've got some arthritis, we can't put that back together, and we can't say, look, it's healed and it's all okay. But what we can do is make sure that it doesn't get worse, or make sure that it doesn't deteriorate, or build up the strength, or give you the confidence to move so that you feel that you can move in a good way. And that's what most people with back pain lack. They lack the confidence to be able to move well. They lack the confidence to be able to go, you know what, I can do with that with my back. My back can bend. My back, is able to move, and I know how to move safely, and I know that I can do it well. Because when you're moving, you want to be pain-free, and if you're not pain-free, you ain't going to move. So that's what I'm really good at anyway. I'm really good at getting people to move. I'm getting really good at getting people to understand what's going on with their body, because we can explain it in a way that makes sense to you, and also explain it in a way that you feel makes sense, so that you can understand it and go, yeah, that does make sense, and yes, I'm happy to now get on and do some things.